Hair can be a big part of your identity, which makes losing it really hard.
Here with us today to talk about this is 9 News medical expert Dr. Payal Kohli. There's a lot of different reasons for hair loss, of course. I think we want to really talk about aging-related hair loss today specifically. What are some of the types of hair that we're losing as we age? I mean, I'm thinking crown of the head.
So two different types of hair loss actually related to aging. So one is exactly what you said, Jenny, which is that androgenetic alopecia, the male pattern baldness. So picture that man who has kind of a spot at the back of his head and then maybe some thinning, receding of the hairline. And it can happen to women as well. And we lose it in the same pattern where we lose more on the sides and then a little bit more at the crown. So that usually starts in our 30s or 40s. And that's that sensitive to hormones. It's called androgenetic alopecia or pattern baldness, male pattern, female pattern. There's a second kind where the hair follicles just get older. That's not related to genetics. So it can be in people who say, oh, we don't have a family history of balding, but it's all over. So the pattern gives you a lot of clues. It's not you're losing it at a specific spot, but you get a widening of your part. You just get less hair. This happens a lot to postmenopausal women who confuse it for the other kind. But which kind it is helps to really determine what works in terms of treatments.
And I see a little biotin there. Do those things work? I take mine religiously. My little, like, you know, I won't name the brand, but a certain little hair enhancer, and I think it works.
Okay, so absolutely not. But
I've heard this from hairstylists too.
You know you're going to say this.
So here's what I'm going to tell you. Vitamin deficiencies are very closely linked to hair loss, okay? But very specific vitamins. So the first is protein. So most women need a gram per kilogram, which means for a 150-pound woman, you need 70 grams of protein. So I want you to go home tonight, ladies, and calculate how much protein you're getting in, because that's one of the most common reasons for hair loss. It's not biotin, but it's protein. Second most common reason, vitamin D deficiency. So your vitamin D level needs to be above 40. Otherwise, you need to be supplementing. And for most people that spend time indoors, our vitamin D levels are low, plus we wear sunscreen, and that leads to problems. Ferritin, which is a storage form of iron, that level needs to be above 70. So if that's low, then you need to supplement iron, especially if you're vegan or vegetarian. It is exceedingly rare to have a zinc or a biotin or a collagen deficiency. In fact, if you take a biotin supplement, the FDA has issued a warning that if you go to a hospital with chest pain, your heart attack test could come out falsely negative because the biotin supplement interferes with the heart attack test. Your pregnancy test could come out falsely incorrect because it interferes with your pregnancy test. So most doctors are advising their patients to get off the biotin supplements. If you're really concerned, check your biotin level, check your zinc level, and then decide to supplement.
Now I'm like Googling, does it have biotin in it? I don't know. But it's like a postpartum hair thing, and I love it.
Interesting.
Luscious locks.
But look and see what it has. Because I love the iron, I love the vitamin D, I love the protein. I am not a fan of the zinc, the biotin, or the collagen.
Interesting.
So it has to be at the right type. Yeah, no data.
I do the little collagen powders. I feel like it makes my skin glow.
It treats your head, not your skin. So
is there like a placebo effect going on here? Because I know a lot of women who say the same thing about these hair products, which I understand that's different. This is postpartum, not aging, but
possibly. But also postpartum, obviously, when the hormones change, it changes our hair pattern. So normally our hair kind of goes over many different cycles. So we shed about 100 hairs a day. If you start to shed more than that, which is 150 hairs, you need to start worrying. And what I say is if you touch your hair and 2 or 3 hairs come out, that's probably okay. But if 6 hairs come out, like in the shower, when you're washing your hair, what have you, that's abnormal. If you're ever losing hair, like in patches, bald patches, never normal. That's alopecia areata. If you're having any kind of systemic symptoms like weight loss or fevers or have any kind of scalp irritation with it, these are all abnormal signs that something may be wrong. Make sure you get your thyroid checked as well, because that's one of the other common reasons our thyroid starts to slow down and we can start to have hair loss related to that. And that's easily treatable, and then the hair comes back. And you don't have to go chasing all those expensive laser treatments and such. Now, if you're losing hair and you really want to grow it, one of the things that does work is topical minoxidil, men and women. So I recommend a 5% foam, and that's usually better than systemic because systemic minoxidil can have effects on your blood pressure.
Shampoo?
It's a foam, and you can get it over the counter.
There's like, they make serums too, like in the little droppers.
Yeah.
Oh, interesting. Now I'm Googling this. Thank you, Dr. Kohli.
So I'm sure you guys have a lot to read about.
Yes.
But try to stay away from pills. Topical minoxidil is okay, and make sure protein, vitamin D, and ferritin levels are good.
Oh my God. Nutrafol has 3,000 mcg of biotin in it.
It's usually about 600% of our daily allowance.
Well,
All
get
right.
off of that.
Good to
Learned a
know.
lot. Thank you, Dr. Coley. You can find more with Dr. Coley at 9news.com/Dr. Coley.